and practice the procedure, okay? I know all of you have done it before, but we're just going to show you how we expect you to do it according to our guidelines. So, let's go through a checklist of things that we need to make safe before we cup the patient. So, this session is just about what you need to do to make yourself safe, what we need for the patient to be safe, and what we need for the clinical environment to be safe. And remember, yesterday you came up with your own clinical guidelines. So we're just going to do the same thing now. So, Fraz, if we just split up into those three headings, and we'll just go around on the floor and ask. Okay. So what do you need to make yourself safe before you start cupping?
Using mask and gloves.
Okay, so what's that called?
Universal precautions.
Yes, personal protective equipment, right? So that consists of what? Gloves, mask, what else? Gown. Okay. Think about even before you get to the cupping stage. Before that. Professor Sosan, you are banned from answering any questions. You give them all the answers. Okay. Before that. Before that. Before that. Before that. Before that. Yes. Before the history and examination.
Ask the God help.
Huh?
Ask the God to help us.
Yes, but you need to do something also. What? Before that. I'm talking about protecting yourself.
Make sure we are vaccinated with the
Yes, thank you. Okay. Vaccination. Who here is not vaccinated for hepatitis B? Who here is not vaccinated? Everyone's vaccinated? Good. Everyone needs to be vaccinated for hepatitis B and show that they have an adequate antibody response to the vaccination, okay? That's our guidelines.
One more thing,
Yes.
regarding the antibody, should be more than 10. Because everybody thought once he got vaccinated, that's it.
Yes,
The story is not finished at this level. You should check also the level of this antibody.
yes. I like it to be more than 100. I think maybe you're using different measuring.
It's the same. 10 and 100
Yes.
is the same.
Or
Ma-
maybe
Maybe you're using different units, but I'm used to being above 100.
because I did ask our infectious disease,
Yes.
and they told me it should be more than 10.
Yeah,
Okay.
same as
That 10 you have to be active.
Yeah, I think just the zeros, there's a difference in the units, but I think we're both saying the same thing.
According to the hospital unit,
Yes,
they should have
yes.
adequate antibody.
Okay,
Lazima.
so you guys should all check your antibody response before you cup the patient. Okay, HIV negative, according to our guidelines, must be checked also. Right, now we can move on, okay, to what? What else do you need to protect yourself? For yourself. We're talking about yourself now. Yes, yes. Okay. So, according to your local guidelines, okay, before anybody touches a patient, we need to make sure they have indemnity or insurance cover in the UK. So you should check your local guidelines also if you need special cover to cup a patient. What license would it come under? Because in Qatar there's a medical license and there's an alternative health license now. So you need to check with your authority which license applies to you. Okay, anything else? Now we can move on to the personal protective equipment. All right, we said face mask, gloves, anything else? Gown, okay, or apron. Anything else? For you. Yes. Glasses, yes. Who disagrees that we don't need glasses? I always say glasses. You know why? I'll tell you a personal story. I know Sarfraz has heard this story before. And Khalib, but I'll justify my case for wearing glasses. So, I was doing a procedure on a patient. It was the 1st of January, because I remember it well, because the day before is very busy. It's New Year's Eve in England. And my colleague called in sick the night before. I was doing a full night. My senior colleague also called in sick. Okay? So I was responsible for the whole accident and emergency department for that day. By 7 o'clock in the morning, I was absolutely exhausted, and I had to suture someone's head wound. Okay? I was injecting his head wound, and he was an African man, and all of a sudden I got lignocaine stained with blood into my eye with the pressure. I was wearing glasses, by the way. I asked this man, I said, look, I know I've taken a history from you, but is there anything you haven't told me? He said, oh, by the way, I forgot to tell you I have HIV. At this point, my heart went into palpitations. I started sweating, and I ran out of the room to wash my eye and went for the post-exposure prophylaxis in the nurse's cupboard. Okay? The moral of the story is glasses are not protecting you against blood splash injury. Okay? It's up to you if you want to take the risk, but we always advise you to wear goggles. I had to have 9 months of blood tests and take medication for a whole month, and I was completely out of it. So, okay. Right. So, goggles. That won't make you forget, right? That story will make you remember? Okay.
What medication did you take? Antiviral?
Antiviral, yes. It's got a lot of side effects, by the way. I can tell you from experience. Okay, my wife was not happy. Okay, so what about the patient? What do we need to do for the patient?
Ask him or what?
What's the
For the patient for what?
yes? What precautions do we need for the patient to make sure the patient is safe? Yes.
Not high, so if they are fainting, so
Yes. So they need to be in a position where you can lie them down quickly. Okay.
also you need to have sphygmomanometer around you, so in case of fainting. So you
Yes.
have to take the blood pressure.
Yes. So you need a couch, not a sofa in your front room or in your living room. Okay. Anything else?
So you know, we have like a table for massage.
Yes.
You can, the best things I think not when he standing or sitting on the chair.
Yes.
I think the best way he must sleep in his face.
Yes. It depends on your preference and whatever you feel comfortable with.
Because the patient didn't feel daisy.
Yes, no, I agree with you. Having the patient lying down or supine is best to stop fainting episodes, but some people prefer to have it done while they're sitting. As long as you can get them in a comfortable position, it's fine. Anything else for the patient?
You should protect him from transferring an infection to him.
Yes.
So you should do sterilization good for him.
Oh, your equipment needs to be sterilized, yes. Okay, anything else? Single-use equipment, yes.
For the patient, you need another person should be around in case of
You need an assistant. Yes, good.
CPR or anything.
Anything you should have in the room with you for the patient in case anything goes wrong?
Oxygen?
Maybe
Yeah.
a juice or something that is diabetic.
Yes, something sugary to drink in case they feel dizzy or lighthearted. I always have some juice and water,
Or honey with
or some honey.
Honey.
Yes.
I would like to add something about the couch.
Yeah.
It's much better to be hydraulic bed.
Yes.
To move his position if he is exposed to fainting.
Yes, I
In the-
agree.
In the stable clinic, I know we didn't bring it here, but it's much
Yes,
better
yes.
to be hydraulic
Yes.
bed.
Okay. For the clinical environment, what do you need to have in place?
Temperature.
An adequate temperature, yes. Yes. Ideally, the floor should be a wipeable floor, okay? And what do you need to have for disposal purposes? Sharps bin? Anything else?
Gowns.
Gowns, yes.
Disposable.
Clinical waste bin. Well, I would recommend you have a phone also in your room, just in case you need to call an ambulance, okay? Also, in the UK where I practice, I have an allergy kit with some adrenaline, just in case there's an allergic reaction. I mean, all clinics in the UK need to have defibs and allergy kits. I also keep a blood spillage kit as well in case there's a blood spillage. Okay.
Use it? Allergy kit?
I've never used it.
What about the vital sign?
But if something happened and I had to do something, I wish I would have it. So it's one of those things, you might throw it away after 6 months because it expires, but it's better to have it.
Somebody mentioned vital signs.
Yes.
Yeah,
Yes. So basic physiological measurements, you need blood pressure, pulse oximeter, temperature, glucose monitor. These are just basic things. Okay, so let's see if you got all of that. Okay, so this is our practitioner checklist. So we say immunization against hepatitis with an adequate response, HIV negative status and hepatitis C negative status, and no active or communicable disease. Okay. For the patient, we said that they should have no clinical contraindications, no history of allergies to any components of cupping. For the HIV and hepatitis C, this is just, they don't have to be negative for it, but you need to know their status, okay? And then physiological measurements, we said within normal limits, patient has consented and you've got a chaperone or someone assistant there with you to help you. And then for the clinic room, so you said temperature, lighting, space, couch, emergency access, hard surfaces, sharps and clinical waste, emergency and blood spillage kit. So you got all of them, okay? Just a word about documentation. I mean, you should really document everything you're doing to the patient, okay? Including monitoring any side effects they're having during the treatment. Consent is a must. It's just like a medical clerking, so it's just like a patient's medical record. I won't go over this too much. What I always do is when I bring the patient back, I always document whether they had any side effects from the cupping, if there's any active sites of infection, just for your audit purposes, and so you can monitor your own performance as well. Okay, so as I said, these guidelines are based on UK, but your local guidelines may vary, so just check with your local authority beforehand. We've done this. Okay, we've done this also, we mentioned this before. Okay, so we just move on to the demonstration now. I don't know if there's sound, but I'll try and get some. But I'll talk through it if we can't hear anything. Part 2. Oh, hang on. What?
Go down. Check it. It's restricted.
Yeah. I don't know why I'm on restricted mode on YouTube. It's not that kind of video.
Yes, the same in Mecca, so in the university,
Yes.
there's certain times you cannot get access to YouTube.
Because
So all the stuff they don't waste.
Okay. Oh, I see. We will try. Yeah, play it.
Everybody, is sound on?
Sound.
Have you update? Update, yeah.
Up to it. Now play it. Okay, so what I'd like you to do is just to watch the video. Don't comment on my performance, just the procedure, okay? Huh? Anything, any feedback? If you want me to change anything for the next video, just let me know. We are flexible.
Mark said. Oh, you took the wrong video.
Oh.
الله عادي ما تتفوت ما اظن في احلى من طلعت الاستراحه مع الشباب ولا ايش رايك بالله؟
We don't want to watch that. That's later.
The big screen, eh?
By the way, I did this in one take. So this is just emphasizing safety around the patient, the practitioner, and the environment. Okay, just what we've been through. Okay, so this bit of the consultation is to do with the procedure itself. I'm going to take you through each steps of the procedure, but before we need to make sure that everything for the procedure is nice and safe. So we've got our factors that affect the patient, the practitioner, and the environment, PPE. This is what we're going to do for the patient. So we've got a nice comfortable chair for them to sit on. In case they feel dizzy or lightheaded, we've got a couch just in case. For infection control purposes, we've got the sink with sanitizers, clinical waste disposal. Comes to myself, the practitioner. I'm bare below the elbows, as you can see, wearing my protective apron and scrubs in case there's any blood spillages. And I've got my protective mask at hand in case I need it as well. Okay, let me take you through some of the equipment that I'm going to be using. I've set up my trolley quite conveniently with everything on it that I need for the procedure itself. I've cleaned this all beforehand and laid out a sterile sheet for myself to use so that to minimize the risk of infection. First of all, to clean the patient, I've got my chlorhexidine spray, which I'm going to use to disinfect the skin. Once I've done that, I've got my gauze here to wipe the skin clean in a single circular motion. And then I've got my clean cups, which I've sterilized beforehand with the chlorhexidine. And I've got a variety of sizes in case I need to change any of them during the procedure. I've got my single-use pump, which I'm going to use to apply the suction. And then I've got a variety of blades to make the incisions on the skin. Once I've made the incision, I've got my clinical sharps bin at hand so that I don't have any nasty injuries from sharps and I can dispose of the sharps as soon as I've used it. Once I've cleaned the area after application, I've got my bandages at hand, so I've got some Newport dressings and some gauze with some tape in case it's a big cut. And then I've got my antiseptic cream as well to disinfect the area. Just some chlorhexidine with a local anesthetic on board. For my clinical waste, I've got my clinical waste bag here, which I will dispose of in the bin, which I have next to the patient after the procedure itself. And just in case we have any accidents or any allergic reactions, we do have an emergency kit which has adrenaline in it in case we have any nasty allergic reactions that we weren't aware of when we were taking the patient's history. Okay, any questions? Any questions about that?
About the gauze.
Yes.
Why is not sterilized?
Okay, the gauze is sterile. It's sterile. Yes.
One question is for,
Yes.
you said in case of patients develop any reactions or you already prepared for the adrenaline or so you have already the kits for the
Sorry,
Okay,
1 minute.
so this bit of the consultation is to do with
I'll just pause this. Okay, so the allergy kit has an EpiPen. It's intramuscular, so you don't need access, it's just direct intramuscular. Okay.
Not alive.
Sorry?
Saudi Arabia is not alive. Or you don't have
Really, you don't? If you don't have EpiPen, you just have to use an ampule.
No, usually when they lamp you with a needle, that's it, you don't need the EpiPen. So with the allergy kit, you have an EpiPen. But if you don't have an EpiPen, just one ampule of adrenaline.
I know. But the EpiPen is not there.
Okay, so we move on to the procedure now.
In the government, MOH, so they ask for this.
For
Oh,
adrenaline.
huh? The new regulations, about 6 months now. They put the new regulations. It's similar to this. Similar.
So this is how we would expect you to do the procedure for the exam. Okay, I know everyone does it slightly differently, but this is the standard way that we recommend doing it. I'm not wearing goggles and mask because it's a video, but normally I would. Okay.
Okay, so we've got our patient position here. Just check that they're comfortable. Yeah, are you okay?
Yeah, very comfortable, thank you.
Okay. And you just want to be able to make sure that you're communicating with the patient during the procedure, just so that they can tell you if they're feeling unwell in any way. We've got the patient exposed to the area that we're going to treat. Okay, so patient is adequately gowned. If you have a look at their back, for this patient there's lots of little moles on the back. Now I'm a GP, so I can tell that everything seems to be okay. There don't seem to be any suspicious lesions. But if I weren't sure in any way, I'd probably not apply cupping on this patient. Okay, so let's start with disinfecting the skin first. And remember, once we've disinfected the skin, we're not going to touch that area again.
That's very
so
important.
Yeah, I'm just going to put some cold spray onto your back. This is my chlorhexidine spray. Just squirt the area that we're going to treat. In this case, this area right here. 1, 2. And I'm just going to use my sterile gauze, single wipe, to make sure I don't go over the same area again.
So when you wipe over an area, once you spray the area and you clean it, now you're not going to touch that area again, okay?
And now we're ready to apply the suction. I've just chosen my cup, which I've chosen a medium-sized cup now. Get my pump. So yeah, here you're just going to feel a little bit of pressure on your back. Okay. 1, 2. Now you can see I've applied the cup. I check that it's not moving, and there's blood now coming up to the surface, and the skin's going quite red. We're going to leave that on for about 3 to 5 minutes for there to be adequate blood flow in that area. Okay, so the cup's been on for about 3 minutes now, and as you can see, the skin is not going blue. It's adequately red and perfused, so I'm happy there's enough blood coming to the surface. I'm now going to take that cup off. Just going to release the pressure with the valve, lift the cup off, and then just pop it onto a clean surface right here. Just going to warn the patient what's going to happen next. So yeah, I'm just going to make some small cuts on the skin. They're going to feel like small scratches, all right? Let me know if there's any discomfort.
So I'm going to stretch the skin, but I'm not going to touch this area, okay?
Remember, I'm not touching this area now because I've already cleaned it. And I'm going to stretch the skin and just make some small incisions on the skin to allow the blood to flow to the surface. And it's a very short, sharp movement. I'm not cutting, I'm just actually touching the surface.
So I'm not going like this, okay?
I think that's enough. I'm going to put my blade into the sharp spin straight away so I don't scratch myself. Popping my cup back on now. So yeah, here we're just going to pop the cup back on. You might feel a little bit of heat coming through now, alright? Okay. So 1, 2, 3. There we are. Check there's enough suction there. We don't want any nasty blood spillages if the cup comes loose. And just check that it's in the right place. Now we have blood flow. And as you can see, the blood is flowing quite freely now. And we're going to leave that on for 3 to 5 minutes. Just going to check the patient's okay, still talking, not getting too cold or clammy. Okay, so I think this cup's been on for long enough now, and there's enough blood in here, and I'm happy that I've got good blood flow. So I'm going to take this cup off, making sure there's no blood spillage, and it's going to go straight into the clinical waste. Okay, so I'm just going to release the pressure now.
This is the most difficult part.
For a bit so that it gets enough time to coagulate, minimize the risk of spillage. I'm just going to lift the cup up and wipe from underneath with my gauze, which is still clean. Just wipe the surface and it goes straight into the waste bag. As you can see, that area is nice and clean. We're going to put some local anesthetic on, still making sure that there is no touching the area that we've cupped. Put my anesthetic cream on here with some chlorhexidine.
Yeah,
again wiping it.
This has got anesthetic and antiseptic in it.
Okay. The same area twice. Straight into the chemical waste bag again. And I've got my bandage here that I'm going to place on top of the wound. Still making sure I'm not touching any part of the middle.
You can, but we just use this. It's got chlorhexidine in it already, the cream. Yeah.
What kind of cream is it?
Chlorhexidine and lidocaine.
Mevo you can buy.
Mevo I don't use.
Just like that. Secure it. And then we have 1 cup complete. Okay, so now it's time for a bit of housekeeping. Everything's going to go in the clinical waste that's blood stained. We got rid of our sharps already, so we don't need to worry about that. Here's my clinical waste bag that I had at hand. It's going to go into the clinical waste. So just take this off. Hold that up. Inject everything. And that's going to get incinerated. My gloves and apron will go in there too. And I've got a nice and clean pair of scrubs for my next patient. We will show you. We will show you. Okay, any questions? Now, this is, I want to emphasize, this is not the actual procedure. You will see me touching things. It's not sterile, okay? It's clean because I never touch that area again. You can't avoid, you can't maintain sterility for this procedure, but you can make sure that the area that you've cupped is never touched, okay? And that, alhamdulillah, with this, I've never had any infections personally. I never had it. Okay. What's that? It's interference. Just leave it.
Welcome back to autoplay. So we go switch autoplay.
Oh, it's you. We'll watch it later. Okay. Right. So, any questions? Yes.
Besides fluoxetine, can you use other materials like povidone IV for cleaning, patient cleaning?
You can. You can.
How many cuts?
How many? We're going to go through that in a minute because you made up your own checklist yesterday, remember? Okay. Yes. What we'll do is we'll go to the list that you made for your own questions yesterday and go through it one by one. Okay, so you make notes on whatever area you need to. Okay, so now we're talking about wet cupping, okay? Not dry cupping, wet cupping. So we said you wanted to know or make your own guidelines regarding the number of cups that you can apply at any one session. Okay. Any advances on 1 cup? Raise your hands. Maximum number. 2,
4,
3.
How many cups?
Yeah, how many maximum cups? Normally, these are guidelines. Obviously, some people will be able to tolerate a lot more. 4,
7. No restriction.
5.
Is the first time, is different than the second or third?
Yes, thank you. So it depends. Is it the first session or the second session or a follow-up session? Are they used to it? Okay. How about the first ever session, first time they ever had cupping?
5.
Yes?
From the 3 to 5.
3 to 5.
3 to 5 is a good number. Okay. So first session, we normally recommend no more than 3 to 5. And then afterwards, what's the maximum you've done?
Maximum 9.
No.
9.
I don't go above 9 or 10. But I would not recommend going above that number.
If it's ever 9 cups, it's only just 3 or 4 cups which you would bleed a little bit more.
Yes.
And then the rest of the cups are very light, incisions, light suction.
So how much blood is in a cup in milliliters? 5 to 10. If you have 10 cups, how much is that? 100 mils of blood, which would not cause a physiological corrective response. Okay, so it's safe. Okay. Timing and duration of cups. How long should you keep a wet cup on there for?
3 to 5.
Good, well done, you are all listening. Okay, 3 to 5 minutes. The suction and the pressure, you saw me applying the suction?
2 to 3.
Yes, so some people, it depends on your hand, okay? Some people will do this. Some people will do this, okay? A good guide is the skin bulge. You don't want the skin to bulge excessively and go blue, okay? Normally 3 moderate suctions is enough. And always check if it's coming loose or not, okay? Okay, so then you wanted to know about any particular sites to avoid. So we said the anterior triangle of the neck. Anything else you might want to avoid? The face, okay. Anywhere else? If you've got cold peripheries or peripheral vascular disease, you want to avoid the peripheries, okay? Especially if someone's got, like they get Raynaud's, you can trigger Raynaud's by peripherally cupping, okay? So you need to be careful.
Over the varicose vein, over the incision,
Yes.
over the allergy, over the wound.
Varicose veins, you call dawali? Dawali?
Dawali.
Yes.
Dawali.
Not on dawali. Okay.
Also for any insertion of tendons or ligaments, be careful how you suck. Some are very fine, very loose, so you can actually dislodge and dislocate the tendon.
Yes, very careful with elderly people and the AC joint, because they can rupture quite easily. So be careful with applying cups directly over ligaments. Okay.
And fistula, of course.
Okay.
You can cup around bony prominences, but as long as there's no insertion of a tendon, it should be okay. But if there is, just be careful how strong you are applying the suction.
Okay.
Sole and palm.
Sole.
Sole of the feet.
Sole of the foot.
It's very uncomfortable. If they've got like plantar fasciitis or something, you can.
You can, there's no problem.
You can do it, but just make extra sure it's clean because feet get very sweaty.
Yeah, when
Okay.
you do on the sole of the feet, because the skin is very dry and hard, there's very poor circulation, especially in the midfoot and the heel.
Yes.
You're not going to get much bleeding. You're just going to get very, very
And
minute.
it's quite painful. It's quite painful.
If you want to go any
If
deeper.
you want to, you will put the cup in our peripheral area and
Yeah.
make dragging of the blood.
Yeah.
Suction, divert the blood to the area what you want
Yeah.
to drain the blood to it.
You would raise the leg as well, perhaps.
Okay. What was this? Fire cupping. Who's done fire cupping before? I've done fire cupping before. Officially, it's not allowed. What are the dangers of fire cupping? Obviously, it's going to cause burns on the skin. You don't know how much suction you're going to have. Okay.
For 40 years.
Yes.
with my cup.
Okay. We don't recommend fire cupping because there's no real advantage. The suction pump does the same job.
No,
Yes.
for the- no,
Safe.
Yes.
Safe and safe.
No need to take the risk. What was safety?
The smoke alarm.
Oh, safety goggles. Was it safety goggles?
Safety on hold.
Okay, we've talked about that. Communication with the patient. You said I was always checking with my patient, right? If your patient goes quiet, it's not a good sign. Okay. Or especially if they go cold. So I just put my hand on the shoulder and just check whether they're going sweaty or cold, because often that's an early sign of they're going to faint. Okay.
Yeah. Regarding fainting, in our clinic we have 1 in 5 patients has a mild hypertensive episode, and nearly 1 in 20 has a proper vasovagal where they just pass out and we have to lie them down. So depending on your population type, it varies. Like the Turkish population is quite sensitive, and I found from also working with Middle Eastern patients, many of them are the younger generation. The pain tolerance level is very low, so it's very easy to trigger a vasovagal in them. But the older generations, they tolerate pain a lot easier.
Usually the ones that say, yeah, cup me, they're the ones that faint the most.
You have less episodes of fainting if they're laying down. Yeah, but when they're laying down, what I find is that you don't really know if they're going through a vasovagal or not, or if they're having any episode.
Okay.
Unless you can usually doze off and start snoring, don't they?
Let's move on. Okay, reapplication of cups. If you need to cup the same area twice, do we reuse the cup or not?
The same cup.
Yes.
No, we use the same place.
Do we use it or not?
I'm not using it.
No. Change it. What do you have to lose? Just one cup. So just take the cup off and replace it with a new cup. We've seen practitioners wipe it, throw the tissue, reapply it. You saw in the picture yesterday with the fire cupping. It's not really worth the risk. Just throw the cup and reuse a new one. Okay. You may want to get encourage more blood flow to the area, in which case you apply. Okay, gloves. Please use latex-free gloves in all cases, just in case. Okay. By the way, you have to wear gloves. Last time we at the conference, we had someone saying, "You don't need to wear gloves. I'm so quick."
Yeah. These were doctors.
He's a doctor?
Yes.
Yeah, doctors. Yes.
Doctors are the worst.
Actually, he was a surgeon.
Yeah.
Yes.
So now doctor.
No, you're not going to touch the area. Your gloves aren't going to maintain sterility, so they just need to be clean. So this examination gloves is fine. Yeah. Okay. Also, if during the procedure you get any blood on your gloves, you must change them immediately. Okay. Types of cup. So bamboo, glass, metal, jam jars, plastics, horns. We only include the plastic cups that you're going to see today. Okay, that's it. You get different qualities, so just be careful. The main thing to check is the valve. Because if the valve is not secure, you will get blood spillages. The most important thing is the valve, if it works or not. Confidentiality we talked about. Depth of incisions. How deep do you think the incisions are?
1 to 2 milli.
Yes, thank you. We have consensus. We have ijma. Okay, 1 to 2 millimeters. Okay, depth we've done. Hair removal. Is it needed? The problem with hair is that it reduces suction. So if it's got particularly hirsute person, you need to remove the hair. Otherwise, the cup, they will sweat and the cup will fall off.
I use honey to make a better seal.
Yes.
Take the cup, dip it a little bit in the honey.
Yes.
Apply it.
Or we sometimes use Vaseline.
Honey is more superior.
Yes.
Vaseline, I try
It depends on your experience. As long as it's clean, it's fine. What about cupping on women's head? Then what do you do?
No.
Do you want your head shaved for cupping? No.
No, we use electrical suction device. In the clinic we use an aspirator. We just attach the aspirator to a sterile
Okay, excuse me.
tube and attach the cup onto that.
vacuum.
Yes, the
Yes.
aspirator pump from the.
So with females and the head, you might need to apply continuous suction with one of those electrical pumps, okay? Or you just stand there and keep doing that, okay? Yes. Yes. I normally ask them to remove their own hair if they can. Yes, because it gets messy otherwise. My barber skills are not great. Okay. But yes, ask the patient if they can. Especially with men who want to do the head, I usually ask them to come with a shaved head or very short hair, like grade 1 or 2. Okay. Sorry?
We do shave.
You shave? It depends on your preference. I prefer not to shave if the patient can do it themselves.
Yeah, I never ask anybody to shave because I work in a hospital. I just get the heavy duty aspirator pump and just attach the tube.
If you have one of those electrical suction pumps, you shouldn't have many problems with the hair. But with women, you have to do continuous, or you can do cupping at the base of the neck for disorders that you would normally do cupping on the head for. That's also fine. Okay, cleansing of the cups. So we use chlorhexidine to clean the patient's back. You can also use chlorhexidine with a single sterile wipe gauze to clean the inside of the cup. So that's called cold sterilization. Or you can leave the cups in a cold bath of chlorhexidine to sterilize them. So the technique is called cold sterilization, which is good enough. If you use warm sterilization, you will melt the cups. Okay. Okay. Number of cuts. How? Yes.
I see you spray.
Yes.
Can you use the cotton with alcohol?
Yes, you can. You can. Yes, number of cuts. How many cuts do we need to make? Yes, so it depends on the diameter of the cup. What you want is a regular border around the cup. You don't want any scratches near the rim of the cup, because then that means blood will come through, you will get a leak, the seal will break, and you get a blood spillage. So all your incisions need to be in the center of the cup, okay, not to the side. So far, you just want to draw a circle to demonstrate. So you want a nice clean border around the cut, so big space, because when you suck, you lose that space. So they need to be in the middle. Usually, sorry? It depends on the size of the cup. Small cup, you only need 3. Medium-sized cup, the one we normally use is 6 to 9 maximum. Yeah. Yes, yes. And remember, when you're cutting, it's not like this. Not like the saber-tooth marks I showed you yesterday, okay? It's just, you know, like how a bird is drinking water like this? It's just the tap. You just tap. You don't actually need to do this. You just tap the skin. Like a typewriter, you know, like this. Yeah. Yeah. Yes, the blade. The blade, I'll let you talk about the blade. He's researched every single blade.
Yeah,
No.
when we were doing our research for a master's degree, we looked at different blades and how the amount of scarring they were leaving on the patients. And we initially started off with the medical lancet, and we found that was the worst thing to use because it was leaving quite deep scars on the skin. We tried the Japanese, Chinese acupuncture, hammer needle type things. We tried the spring multi-scratch device.
Yes.
We tried all of them. We tried about 27 different blades, and we found in the end the shaving blade, because we use it on a daily basis. We cut ourselves daily, and there's no scarring. So we just removed the edges of that corners of that blade, and we started cutting the skin. And with that blade, you can't go deeper than 2 millimeters because it's made specifically to cut at 2 millimeter depth. It doesn't go beyond that. And the healing is always natural as long as you cut within the Lango lines of the skin. You're always going to get 100% healing.
We do have scalpels today, but I myself never use scalpel. I always use the blade which I prepare myself.
And we do cold sterilization before we apply that in the hospital. So it's the safest. We've done over over 2,000 procedures with this blade. We haven't had a single skin infection. Regarding healing, we haven't had any visible scarring on our patients. On some patients with sensitive skin, if you really go close and straight to skin, you can see some marks, but from like a meter away or a foot away, none of our patients you can see any scarring on them.
Yes.
What about using lancet?
I never use lancet.
We don't use lancet. You can use lancet, but we find that with the lancet it always cuts very close to 2 millimeters depth and a bit more.
The message I would say to everyone is, if you can assure yourself that you won't go deeper than 1 to 2 millimeters and it's a clean instrument, you can use anything, okay?
Yes.
That you're comfortable with. We're just telling you how we do it. We appreciate there's going to be variation, but the key here is not to go deeper than 2 millimeters and not to go like this. Okay? Yes.
I think the incision by half blade is less painful than scalpel blade.
Scalpel, yes. Scalpel is very painful.
Yeah.
Yes.
It's very painful, but
Yeah.
I think shaving half blade you can do.
Yes, we will show you. You will see what we mean. Okay? Fine.
I mean, yeah, use whatever you're comfortable with, but we find it's the easiest and safest is the
Types of
shaving
cups.
blade.
Volume of blood we've done. Okay. So, the questions that you wanted answered about the cups, the cupping and the guidelines, you came up with the list and we answered it for you. Are there any more questions that you can think of that you want answered now, before we go to the practical?
Yes, I want to ask about the cups. You were mentioning that you sterilize them.
Yes.
If they are just, you get them from the box.
I still spray them with chlorhexidine.
Okay.
I don't know where they've been. Yeah.
If you don't have chlorhexidine, what you are going to do? Alcohol?
You can use alcohol. Yes, you can use alcohol swabs, or in my country they have something called Milton. Okay, it's a liquid that they use for sterilizing babies' bottles. I'll show you.
You can find that here, actually. Milton solution. You've got Milton tablets here. I've seen them.
Sodium chloride.
Sodium hypochlorite. That's what it's called. Yeah, I'll show you.
I have one question on the multiple use of the cup.
Multiple use of the cup.
Yeah.
Okay.
So in hospital, we sterilize the thing with the liquid or DD1, and then we use of the cup. So
You
what's
can
your
press
comment?
Alt Shift.
Is it sterilized in the machine or you manually sterilize it?
With a full sterilization.
Yeah, I think it's all cold sterilization. Amri, the question is that multiple use of the cups.
This, yes.
Multiple use of the cups after cold sterilization. Do you?
No, just throw the cups away.
Because they are so cheap and
Yeah.
so.
This contains sodium hypochlorite solution. You might not have this brand name, but as long as it contains sodium hypochlorite, you leave these in a solution for 10 to 12 minutes, take them out and they're sterilized, okay?
Regarding the pump,
Yes.
do you
Only one pump per patient. Pumps are very cheap now, the single ones.
It's disposable, all the pump and
I always use disposable pumps.
so
Yeah.
you
Single use.
dispose pump and the cups.
because you were use nicer pumps on the video.
I know.
That's why I was asking.
We have this very basic pump which costs very little, and you just use one pump per patient. The thing is, when you do suction, sometimes you get blood going back into the pump, and you can't be sure that they won't cause any contamination afterwards.
How much is the kit? This one you
I can tell you in, what's the pound rate
in
now?
pounds.
5 riyals for a pump.
So it's a pound.
Yes.
Here it's not more. It's
A quid,
more
yes.
Than 5 riyal.
It's
Here
more.
It's more than 5 riyal.
You need to find yourself a good cupping supplier.
Recommend using anesthetic spray before stretching.
It,
It depends on the patient.
the thing I'd say, the question is, do you use anesthetic spray? You know, cupping is in itself becomes an anesthetic when you do the cupping, so there's really no point.
But some patients, like, they're really sensitive, so
Yeah.
and they don't accept, they'll get really
Yeah.
tense. I use it sometimes, look, and wait 5 minutes to 10 minutes before I apply.
Experience by using
Okay.
anesthetic spray, they will cause less stabilization of blood.
Yeah.
Are we all happy? Good. Let's do it. Okay.
Patient insists we can use, but I don't recommend it.
Sorry.
Yes.
You said 5 riyals for the Milton or for the kit?
It depends on your supplier.
Now I'm asking about
5 riyals for the pump.
for the pump and the cups.
The cups,
Probably about 1 riyal.
yeah, about 1 riyal each.
So it's altogether 10 riyals.
Yes. If you go to the right person, they'll do it cheaper for you.
You can order them, you can order
Make a Chinese friend.
But we can order
You can order them from England. Like Sarfraz has colleague who supplies. So you can-
Sarfraz knows someone who supplies the cups. Yes. Okay. Good. Now the bit everyone's been waiting for, yes? Okay.